Today, let's discuss a large group of disorders that can cause progressive scarring of lung tissue. If one scarring occurs, it's generally irreversible. Hello everyone, welcome back to Med-Surg Mentor. Today, let's review the condition interstitial lung disease, or in short, ILD. Alright, let's start. Definition of interstitial lung disease. It is a group of many lung conditions that affect the interstitium, resulting in scarring and stiffness in the lungs, which makes it difficult to breathe and get oxygen into the bloodstream. Etiology of interstitial lung disease. Common etiologies are genetic factors, idiopathic causes, long-term exposure to hazardous toxins and pollutants like silica dust, asbestos fibers, and grain dust, autoimmune diseases like rheumatoid arthritis, scleroderma, and sarcoidosis, and medications like chemotherapy, heart medicines, and anti-inflammatory drugs. Major risk factors of interstitial lung disease are exposure to occupational and environmental toxins, smoking, radiation and chemotherapy, gastroesophageal reflux disease, and middle age. Pathophysiology of interstitial lung disease. It is caused by etiological factors like long-term exposure to hazardous materials such as asbestos. Due to this, there is injury to lungs which triggers an abnormal healing response. Normally, body generates a right amount of tissue to repair damage, but in interstitial lung disease, there is an abnormal repair process which results in stiff, scarred and thickened alveoli. Gradually, the lung function is compromised as it is very difficult for the oxygen to pass into the bloodstream. Major clinical features of interstitial lung disease are shortness of breath, cough which is typically non-productive, decreased exercise tolerance, fatigue, weight loss, and loss of appetite. Important diagnostic measures done to rule out interstitial lung disease are blood tests such as autoimmune markers, CT scan, echocardiogram, spirometry and diffusion capacity, oximetry, bronchoscopy, and surgical biopsy. Common complications of interstitial lung disease are pulmonary hypertension, right-sided heart failure, and respiratory failure. Next is management of interstitial lung disease. They include corticosteroids such as prednisone, anti-rheumatic drugs like azathioprine and cyclophosphamide, pirfenidone that helps to slow down the worsening of pulmonary fibrosis, H2 receptor antagonist which can reduce the stomach acid production, N-acetylcysteine which can act as antioxidant and expectorant. It also reduces the inflammation in the lung tissue. Other managements include oxygen therapy, pulmonary rehabilitation, and lung transplantation surgery. Now let's move on to the preventive measures of interstitial lung disease. They are wear a respirator or a mask in polluted environment, quit smoking, get flu and pneumonia vaccines, eat a healthy diet, drink plenty of water, and ensure ventilation at indoor spaces. Important nursing diagnoses for a patient with interstitial lung disease are ineffective breathing pattern related to interstitial scarring, impaired gas exchange related to poor oxygen intake, risk for respiratory failure related to lung damage, activity intolerance related to hypoxia, fear and anxiety regarding uncertain outcome, and altered nutritional status less than body requirement related to anorexia. Next is nursing care of patient with interstitial lung disease. Common nursing cares are assess respiratory status and oxygen saturation, ensure the quality of indoor air, advise to avoid exposure to potential toxins and harmful gases, administer supplemental oxygen, ensure high-calorie diet, encourage adequate rest and gradually increase the activities based on tolerance, refer patient to pulmonary rehabilitation team, administer drugs to reduce the disease progression, and watch for complications. So far, we have reviewed the disease condition interstitial lung disease. It is a group of lung conditions that affect the interstitium, resulting in scarring and stiffness in the lungs. We have also discussed regarding etiology, risk factors, pathophysiology, clinical features, diagnostic measures, management, complications, prevention, nursing diagnosis, and nursing care. Thank you so much for watching, and if you find this video helpful, please like, share, and subscribe to my channel. Thank you.